We are going to start with the DNA viruses today. And the emphasis again is viruses causing human disease. So you can see all set of problems that we see, and you might see that is doing of viruses on different parts of human body. Okay, and these are human warts. So I'm going to discuss today the viruses causing human warts, different parts of our body. Now, also keep in mind some of the figures that I usually use as an impact slide to give you the clinical significance for that. And in this case, you can look at the envelope, and you look at the genome inside the envelope. And if you pay attention to the background, many times if it's a male and female, as we said earlier, we are talking about STDs mostly. Also keep in mind the size of viruses. And in this case, you can see this happens to be human papillomavirus, and this is HIV. And human papillomavirus again has a circular double-stranded DNA, as you can see from there inside if you pay attention, and is protected by capsid protein. So protein function is protected, whereas in HIV is a retrovirus, which is a lenti group. It has a viral RNA. That viral RNA is converted to DNA. So I just wanted to stress that aspect. And then again, I would want you to look at the sizes, 55 nanometer, and we have like 90 to 130 nanometer, and that's important when we talk of penetration in different parts of the body. Year 2008, these three people were given Nobel Prize in Physiology and Medicine, because physiology is medicine. I think two of them from France and one of them is from Germany. And the whole idea was that they were the one who were the first to scientifically demonstrate that cervical cancer in women is associated with human papillomavirus. So as like a discovery of that nature, that they had to be given a Nobel Prize. So you can see the significance of the role of viruses in causing tumors. Now, these are just copied slides from their Nobel Prize presentation. If you ever watch that, they usually come up with a presentation, and you can see from here all pathophysiology that we discussed as a part of pathophysiology. And then again, there are different type of HPV strains, and some of them have more ability to cause disease as compared to others. So you can see from here that like any viruses, there are different strains, serotypes that we have. Again, human papillomavirus usually has tropism, a liking for being attached to the cervix. So you can see it's going to invade the cervical cell and then cause the problems over time, which could be anywhere from causing acute inflammation to recovery process over time. But nevertheless, that basically is the basis of CDC advice for women in certain age group to have their pap smear. So that's the reason, because of the incidence of cervical cancer and because of the impact it has. And if you look at globally, it keeps on changing, that some of the countries have a very high incidence of clinical cancers, especially related to HPV. And notably, you can see in South America and Africa, India, I think it's Mongolia, but you can check it out. I'm not really sure about that, but these statistics are available to us. The other important thing, again, for your interest, these warts can become very obvious, and maybe all of us may have had once in a while, but if your immune system is not fighting it up, there's a story, there are a lot of videos available. It's going to be interesting for you to figure out one of these gentlemen in Indonesia that he grew like a tree. So the papillomavirus grew like actual tree. They called him tree man. And you can see his hands were growing like tree. So the warts can outgrow in terms of, and there are a lot of videos. I don't want to spend time on that. You can see this is his hands growing as a tree, human papillomavirus. One of the physicians from San Francisco, brave enough, I used to say brave enough because he's not kind of protecting himself. He's sitting so close to the person, I would have been scared. No gloves on. There are brave people around. And they operated on him. Those of you who are interested, there are a lot of videos available, BBC, CNN, so on and so forth. But it's interesting for you to see how would he manage his life, for example, and how his family deals with it. So this is some doing of DNA viruses. Okay, so let's go into microbiology of DNA viruses. We divide DNA viruses into two major family, papilloma-viridae and polyoma-viridae. So these are like, we have Enterobacteriaceae. So these kind of weird words that we use in the end are corrected. So these are family of viruses, and these viruses have an ability of causing different type of infections. So I'm going to discuss that. Different type of infections. In this kind, they have an ability to cause 4 different type of infection: lytic, chronic, latent, and transforming infection. As the name suggests, lytic will mean they are going to infect the cell and lyse the cell. Chronic mean that they will invade the cell and stay there for a long time. And latent will mean they're going to come back and forth. Is there something that unattended bag? That's what you're pointing towards? I mean, it is an unattended bag. Whose bag is this? Okay. I will report to police if next time I see that. That's what we are trained for, unattended bag. Okay, anyway. So transformation infections, if that infection is transformed into cancer and so on and so forth, okay? Now I showed you human warts, but also showed you that there can be different genotypes, and we have list of genotypes suggesting to you that not every virus will cause, and sometimes what happens is that there is a progression of inflammation or progression of a particular type of viruses, right? I think I just want to emphasize upon you as you're talking about viruses keep on changing. So they have an ability to cause different type of diseases. And sometimes it may become all the way from asymptomatic, where you don't notice anything, to being involved in terms of progressive involvement, in terms of, for example, leukoencephalopathy. So these are some of the terms that we normally use when it comes to DNA viruses, especially papilloma. Now, epidemiology, as we discussed earlier, I gave you some pictures, I'm going to give you more. Capsid virus is resistant to inactivation and virus persists. So these are the qualities based upon yesterday's lecture when we discussed why would viral put on an envelope and why would it not. So that again will give you an idea as to what is happening. For this human papilloma virus, the general characteristics are, they are papovavirus. If you look at their DNA, which is circular, and then again, they are dependent on host for transcription of viral genome. So they are dependent on the host. You compare that with HIV, which brings its own enzyme. And tropism, this virus has an affinity for squamous epithelium cells of skin and mucous membrane. If you see the first picture, it was a picture of lips, nipple, penis, different parts of the body where this wart is going to come and appear. Okay, so these basically shows you that they're going to go for skin and mucous membrane, and most often we see as warts in the skin. So if you see any wart in the skin, that's HPV. Human papillomavirus.
Like every wart?
There are, but most likely is human papillomavirus. We'll just wait till we come to that. Okay, papillomas, when we say papillomas, they're on the mucous membrane. Because the problem is that I don't want to get distracted to the clinical picture. You don't need it, and it's going to take a lot of time. But just keep in mind, I give you a general picture of what's happening. So I want to emphasize one pathophysiology that you normally see. The other important thing that I'm going to ask is how are they transmitted, for example. Now, transmission of human papilloma virus is direct contact. That's why I said the guy was brave. Direct contact, shake hand, come near, touch, or sexual contact, and then passes through infected birth canal and laryngeal papillomas. Okay, and I think I'm going to talk about that in a while. But HPV is the most prevalent STD in the world. So that's something you have to see when we see worldwide figures. Then again, as I said, that there's no one HPV. There are different strains of HPV. But HPV 6 and 11 are low risk for cervical cancer. Right? That's information you need to know. Whereas they can cause condylomoma acuminatum or oral and laryngeal papillomas, which are like warts in the larynx, and warts, the same thing that you see on the skin in your larynx and upper part of the throat. And I'm going to spend some time on that. Why would that happen? Whereas polyoma, so we talk about papilloma and polyoma. So polyoma, you will get through contaminated water or you will get through the air. So these are the two different DNA viruses that we're going to make a study today. As far as inactivation is concerned, remember we talked about that in the lab as well. HPV resists inactivation, but it can be transmitted on fomites, anything that comes in contact with the patient, clothes and furniture and whatnot. And again, we may have it on countertops, bathroom floors and towels, and people can shed it off. Asymptomatic shedding may happen. So if you, next time you book your from Trivago and looking for a good deal, 1 star. So all these things count in terms of how they dispose and clean their stuff and towels and so on and so forth. I know some of my friends are very kind of paranoid about using anything over there. But again, all these things are possible in terms of whatever. So they are present everywhere. There is no seasonal incidence. We do have seasonal incidents for flu, for example, but they are present at all time. Unfortunately, and you can guess, there's no mode of control. Even at this time, I don't even remember who would have cleaned this desktop forever since they were made with something antiseptic. You see the point? But at least you should know in a situation when you work in the hospital, come across with the patients, and so on and so forth. The question I'm going to ask again, these are some of the questions I'm pretty sure you must be interested in, because we cannot teach you everything, we cannot ask you everything, but some of the things for pathophysiology are important. Direct contact, right? And then again, small breaks in the skin and mucosa, which you don't notice. Okay? During sexual intercourse, while infect is passing through infected birth canal and contaminated surface. Pretty much the same that I already told you. And then many a time people ask you, if I tell you, I'm going to tell you some incidences, people are going to come and ask you, right? It's Vivian, right? What's your son's name, Vivian? How old is he? 6? So his son came to me, says he is going to have a tonsillectomy, and I was amazed the type of question he was asking. If I was to ask you in the exam, you'll all fail. So things are changing. A 6-year-old knows what's going to happen in terms of tonsillectomy. He knows the clinical thing. Right. It's all out there. That's why we are in a big challenge these days. People are going to ask you something that they would have already investigated, and you don't want to cut a sorry face in front of them. So HPV is passed through genital, skin-to-skin contact, but most often is vaginal or anal sex. And again, people would never know that they are passing it on to their partner. And CDC believes that the sooner they start having sex, they are passing it on to the people. And this is not to do with high-risk people. It's not to do for people who may have one partner. And I told you CDC consider more than one partner means minimum 4, so 4 and more. But people who are in monogamous relationship, there you go. The moment, very first time, you don't even have to get tested for that. The chances are that you are infected. Now, sometimes we ask what are the risks if you compare from papillomavirus and polyomavirus. I'm just taking two things together. I think you want to understand that. When you say papilloma, I told you about warts. Sexually active people are at risk for infection. Again, HPV is related with oral and genital cancer. There was a time, probably it wasn't true, but we used to associate genital cancer with sexual activity, and we used to think vaginal, penile, at the most anal. But since people have adapted to other means of sexual contact, especially oral sex, so all those warts, papillomas, or cancer are appearing in throat and larynx, which is serious. And we're going to discuss that, especially in this part of the world. But polyomavirus is present everywhere, especially people who are immunocompromised. Again, we already talked about that. It's a repeat slide of what actually looks like. The other polyomaviruses that are out there are there for academic interest. I'm not going to ask you, but keep in mind that we are not bothered as of now because they don't cause disease. But if there are polyomaviruses that cause disease, then we are worried about that, right? You don't have to remember all this pathophysiology in this part of the class. The only thing that you have to remember from here is that there are other viruses. Since they don't cause the disease, we don't care for at least this part of the course. If you were, oh my goodness, what's that? Remind me later. Okay, I don't want to be reminded right now. So in a typical virus, regardless of whatever viruses we are talking about, especially for adenoviruses, once they go into the system, right, then they have an ability to go to the lymph node, and from lymph node, they can go to the blood, which is primarily viremia, and then blood can take them to wherever the blood goes. Okay, so there is, like bacteria, there are two ways of this invading into the system. One is via skin or mucous membrane. Both can go to the lymph nodes. Or if it goes directly to the blood, again, there is a circulation between the blood and the lymph node. So either way, it is going to go to different parts of the body depending upon what receptors those viruses have and what are the corresponding receptors present on the other end of the cells. So they will match and then cause infection. Okay. Now, if you look at some of the incidences for cervical cancer in women in their 20s, and then see as they grow, so this is like 20 to 24, like 5 years gap. So you can see as they grow, the incidence of cervical cancer is increasing. So these are statistics that form the basis of who should have pap smear, who should have Gardasil, what is it you need to do to educate people. But again, it's variable. They have to change the data very often to make sure that it reflects the true incidences. And then people may ask you, and especially worrying for women, that what do I need to do? How can I prevent cervical cancer? If the physician tells you you can get it like one sexual contact, and there's no way of finding out whether your partner or yourself are infected. So how do I protect myself? So you can see there's a list of things that are there by CDC, right? So I'm going to leave it on you to read it, but I'll just give you some of the things which are important as a basis that I don't want you to be on extremes. Totally careless and be paranoid. because it will make your life miserable either way. It has to be something out there in the middle path. For example, if you have doctor's appointment, you better take care of it. And then again, anything that causes your immunocompromisation in terms, like, for example, if you look at statistics, they will say, hey, if you're smoking, there are more chances of HPV. So all these things are interrelated, right? I don't know where you're going to draw the line, but the good thing is that CDC and the government sometimes intervenes and makes some, not decisions for you, for suggestions for you, okay? So they would never say total abstinence for stopping of STD, though it's academic. So at the best, they will say, okay, give them condom, give them sexual education, tell them, whatever they want to do, to such an extent that even they would not even stop people who are in sex industry and say, hey, it's fine with us, like, we can give you a license, but you make sure that you get your HIV, HPV and Hep B test done, and let people who come and visit you make their own decisions. So these kind of things are a little bit convoluted, but I just want you to have a feeling that what to be and where are the sources of that. And some of the things, it could be, I wouldn't say economical reason as well. Some of them are based on research as well. And then Gardasil, for example, So CDC will say, as I said earlier, vaccination is recommended for 11 to 12-year-old girls. But you can argue, you just said that if you're not having sex, you don't need to have it. So what CDC would do is collect the data of what's happening in the school, what's happening in the general population, when the teenage pregnancy, so on and so forth. So according to them, the moment the girl has a menarche and he has menstrual cycle, even if she at that time is able to conceive. So they're not going to leave it on you whether you have sex or not, but they want to be proactive, especially to the parents. Okay, let's give them Gardasil. Okay. Otherwise, if you're going to wait for that, hey, let's wait before they have a first sexual contact, and people can wait all their life to have first sexual contact, but there's very few people that would do that. So CDC would not go for extremes. They would rather go for that. Okay. The other question is that you have to get 3 vaccines. I don't want to go and teach you why you should be. We already discovered that and discussed that in immunology, the booster doses. And I remember they were saying that then also the companies who make it, they have to have a disclaimer as well as to what is going on.
Give you your sign for Friday.
Okay, great.
Make sure your students know.
All right, thank you. No problem.
Do it in front of the rotunda.
Okay, great. Thank you.
Really hoping to see lots of pharmacies.
Okay. All right. So now you know why we wanted to finish classes earlier. Anything can happen. All right. So also keep in mind that if the company say, hey, if you give this Gardasil, you're saved from genital warts, and you get this genital warts. So there's a disclaimer over there that you have to keep in mind, as you say, none of them treats existing HPV. There's no treatment there. It's best protection. Okay, so these are some of the terms they use and some of the things that are there. The other question is that people, if I tell you, which I'm not going to tell you, how do they make that Gardasil, it's complicated, then you will start thinking, maybe I'll get HPV from the vaccine. There's a conspiracy theory for vaccination altogether. So I'm going to leave it on you. I'm going to just give you the legitimate or proper information. You decide for yourself. Okay? So I don't want to have very specific. So this is what CDC looks like. And this is what sometimes states look like. Federal government can make some laws. States can kind of intervene on that. Abortion, so on and so forth. But again, you can see this is what they do. So they are state HPV vaccination policies based upon whatever the incidences they had, whatever costs are involved, especially if it's going to be covered by, if you ask Gardasil to be covered by your health policy, it's very expensive, so they will undermine the research. I mean, these are like political, geopolitical issues that you see. But as a fact over here, you can see some of the states have a very high incidence, right? And I remember a couple of years I used to teach that Gardasil or all this HPV was for a female because we were talking about the cervical cancer. Things change over time, but now they say with a very high incidence of people having oral cancers, and I told you why. So now they want to advocate for boys as well. So things will be changing over time, especially in gay populations, you know, even in non-monogamous relationship, as I said, it's very common. So these are some of the incidences they want to keep in mind, and these are like disclaimers that you need to know about, and they're all there for CDC. They keep on changing. If you ever want to advise someone, so if they ask for the references, give them CDC reference, you know, and you can see from here, check for all HPV type, for example, types of HPV vary, and then so on and so forth. So people have a very clear understanding, but as I said today, things are changing, right? So it's a difficult world these days. People, if a person has a wart, HPV on genital, is going to do more research than even you taking microbiology exam, I can assure you that. And many a time, if they come and ask you a question, you know, they basically are going to judge you, whether you know it or not, right? So that's a challenge in the modern world of cancer. Again, all these statistics are available. I'm going to leave it on you to read, recommendation, and so on and so forth. Okay. Now, if you go as a worldwide, because if you look at, because remember for viruses, we can go for DNA. If you look at the worldwide picture and compare that with those countries or those states which want to use Gardasil versus not Gardasil, so you will see that some of the countries, as I said earlier, for some reason, and the reasons are given in WHO's detailed recommendations, they have a higher incidence of HPV. Now, the point that I wanted to tell you, for example, in this part, because fortunately, US has a better system for taking statistics, and the statistics are much, much better than any other part of the world, but that also may create a scare. So this is an old slide, let me accept that, but I just want to give you an idea as to what is happening because they keep on uploading the newer versions for that. Again, you can see population group, the CDC, non-Hispanic white, non-Hispanic black, and Hispanic. So they kind of go across age, and you can see from here in terms of incidences, percent of women. So it's scary, 40%. 4 out of the 10 women in non-Hispanic black has already HPV. And I mean, it's an old set. It's like 2004. I'm pretty sure if you look for CDC, it nonetheless is on the increase. So that's a problem for the public health. It's a problem for the state. It's a problem for CDC, and this is a challenge for them. Okay, but if you remember gonorrhea and other thing, you will see it was like much of a difference, but even is 40, 25, 27, 29 is equally bad. But that's factual. Now, the other problem, as I said, because of people's sexual preferences, again, you can see from here, I want you to pay attention if possible. You can see talking about head and neck cancers, right, and anal cancer especially. So I already told you there was a time we just used to limit our cancers to the genital regions, but now is expanding. The most horrible fear that we have is the cancer associated with the head and neck. Because if it's a cancer somewhere like breast or cervix, you remove it. What are you going to do with the head and neck cancer? Decapitate? There's nothing you can do. It's very, very annoying and very terrible picture. But the incidences are very high. So again, if you look over here, it's so blurry. I don't know, maybe you have a better version over here than mine. Let me see if I can enlarge that. Okay, better. So you can see over here, this is an age-related in females or males on the top one. And you can look from here, females are solid and males are hatched in terms of head and neck cancer. So head and neck cancer, just for example, black race in male is so high. Okay. And if you look at, for example, anal cancer, this is the incidence again for the anal cancer in the United States. Again, you can see, unfortunately, it's pretty much the same in all of them. If you look at this population, whites and blacks, male and female, females have more. Now, CDC also considers that they used to think that anal cancer was something to do with gay population or male homosexual. But again, if they look at the preferences that people have in a monogamous relationship, that they may have a vaginal or anal sex at the same time. So we will, their incidence of getting cancer will increase, right? Because male homosexuals or male will have exposed area in anal cancer, but you have both anal as well as vaginal cancer in terms of the incidences. But these are the figures out there, and I don't want to go in much detail, but you can see that the incidence is quite high. The other thing that CDC is worried about, and HPV, I mean, the way we are going right now, that if you're HPV positive, the cancer is spreading among the middle-aged. But also keep in mind that cervical cancer is not the only cancer that can develop. I just gave you an example for head and neck cancer. I didn't go in detail. What kind of cancer, you know, which part of the world. So these are available. They are available. But you as a pharmacy student, you know, and I'm just emphasizing it over and over again, and you can read it on your own, that the part of the problem in these cases is anybody, male or female, involved in oral sex has a very high incidence of getting any of those head and neck or genital cancers. Now, the other important thing is that they are trying their best, right? And some of the ideas, they want to educate the people, but the problem in the red say the oropharyngeal cancers, right, are not the only malignancies. So there are other malignancies which are coming up as well, to such an extent that we see like more than 14,000 cases every year. So that's a burden. You know, once I think Dr. Petrova must have taught you about the economical burden of, you know, the diseases and policies and so on and so forth. So these are also to be considered, right? So your objective is not just to know in the class and get in this class and know there's something in real time which is out there for you to advise people and see the impact for that. Now, if you look at, for example, another slide that I got from CDC is that if you look at HPV-associated cancer per year, right, in both women and men, so you can see women have a very high incidence of cervical cancer, vulvar cancer, and vaginal cancer. And then again, for some reason which I gave you, they also have a higher incidence for anal cancer, right? When we look at the HPV-associated cancers, so you can see head and neck are more in men as compared to women. But one thing is sure, and you can again keep in mind that CDC does a good job. You have to appreciate that. So they covered a large study, 83% of the US population. So these are statistics not cooked up by a microbial immunologist. They're real-time statistics in terms of what is the incidence of cancer and what is happening out there. If you look at the cervical cancer, all cervical cancer are caused by HPV. And I give you an example, the guys won Nobel Prize to associate that. Whereas some cancer for vulva, vagina, penis, anus, and other oropharyngeal are also HPV associated, right? So these are some of the complicating factors that we have, and we see that. Now, if you look at state-wise data, like for example, some of the states, so these are all cancers: cervical cancer, vaginal cancer, oral cancer, penile cancer, so on and so forth. So you will see every state has its own incidence. And some of the states, for some reason, southeast, I believe, and the lower, like they say, tropical, have a very, very high incidence for all the cancers that I mentioned. Okay, now, again, the question is, there's too much information there, it's rapidly changing, and to such an extent that my whole objective for just taking 40 or 50 minutes to give you an overview, a bird's eye view, which may be a better description of a real threat. So you know the basis of that. So you at least can make, the whole idea for the lectures in microbiology is to help you read the material on your own. So kind of give you some instruction how to read the material and how to assess the material and give you in terms of the factual knowledge. But again, you can see from here the facts. These facts again are there. Cervical cancer is caused by a common virus called HPV. And as a rule, as I said, anyone who ever had sex can get HPV, period. There's nothing to do with the high-risk group. The question will come, how can we prevent cervical cancer? You have to do regular screening tests. Pap test is there. And then again, I would not go into that detail, how to interpret the Pap test, why do we do it, and so on and so forth. But these are something that has to be sought out by specialists. Okay, but just to give you a rough idea that if you were to go for your test, for example, this is another data that I wanted to relate. A lot of studies have been done to relate a cancer, for example. Let me see, a cancer, HPV, to the number of male sexual partners that these females have. So you can see, if you were to look at this curve, it's directly proportional. So that's what the CDC will come up the data with. So the more the number of partners, sexual partners a female have, is directly proportional to her having the risk of getting HPV. Okay, so whatever facts are given over there, they are to be taken in context with what are the data which is out there. Okay, now let me give you a little bit of pathophysiology, and I think or somebody must have taught you already. So what they do is that if you look at, well, I should have showed you the normal as well. It's very early stage, so you can already see something happen. You talk about the uterine bleeding. And then again, as it moves along, mid stage and late stage, it really gets to such an extent that not only that it's going to be cancerous, but by the time you diagnose it, it's already there. Now, this picture maybe will give you an idea. Let me see if I can get a better view of that. Right. So let's say if you want to look at a 148 million population, right, and look at the people who are exposed, which is like 111 million. People who may not be exposed, because you have to exclude infants and babies and children, so they are not part of the study, assuming that they are not involved in those sexual practices. So CDC thinks 10 or 11 is kind of an age that in this country people are already having sex. Now, the problem that you see over here, and this is what we call, does anyone know what kind of graph that is? Huh? Pyramid, but this is the name for that. Pie chart. Where do they sell these triangular pies? Okay, maybe he talks about the portion of the pie. Anyway, so tip of iceberg. That's what we call it, tip of iceberg. So you go over and say, hey, 1% of the people are going to present with genital warts. So you are waiting and say, hey, 1% is not a big deal. But you don't know what is happening in the real world. So that's what the problem is, that they look at population and they want, for example, look at colposcopy, looking at the uterus, cervix, and then go for all the different tests that are out there. So these advices are to be taken seriously, and all those recommendations are to be taken seriously. The only difference is that you as a healthcare professional should know as to what are you looking at. For example, a little bit, one more pathophysiological idea. So you can see from here, they keep on looking at the cells, and then sometimes viruses go and invade those cells. Once the viruses invade those cells, they proliferate. The object of Pap smear is to notice the disease right from the beginning so that we can do something, right? In situ. We call it so you want to pick up virus before it infects so we can do something, okay? I noticed from the last couple of days that I'm becoming very popular these days. The people are making study cards on my lectures. Very good. If they are making for my lectures. Okay, because one of our capstone students were mentioning to me that let's make some study cards for the students to help them. So maybe, where is Lansford? So, good. Anyway, you can see this is an extreme form of cervical cancer, right? And this is a vulvar cancer. So this is normal that you expect for all the Pap smear. And then again, things can get complicated. The idea is called carcinoma in situ, CIN. Is there deeper buried, just the beginning, nip the evil in the bud. That's what it says. You just want to make sure we get it in time, because by the time you are going to explore that, it may be too late. Again, those of you who are interested, I've already talked about that in cancer, or maybe somebody else will come and explain that to you. It was basically when I taught you pathophysiology of the cancer, pretty much the same thing. What are the stages of invasion of the viruses? And you can see from here, the problem that I want to emphasize over here is virus HPV is going to go and get buried in the basal layer. You would not notice on the top. That's why for Pap smear, they did punch biopsy. They punch the tissue. They punch the tissue because you want to look at the laser. You want to find it here so you can do something. By the time it kind of moves forward and becomes like a cancer, probably it's too little too late. Okay, legend for the figure. And in the last 5 minutes, I'm just going to give you another idea for another DNA virus, adenovirus. And adeno, as I said yesterday, is something to do with the, what you call adenoids, something to do with the epithelium that produces secretions, okay? So another thing you can see that these viruses were there causing problems, but very recently, 1953, we were able to find them. And again, hundreds of serotypes, right? Unless you're doing a course in virology or become a virologist, I wouldn't expect that you know all those 47 that cause human diseases. But the most important thing that you need to know, all human serotypes have a single genus within the family, Adenoviridae, right? So they have a DNA virus, a DNA genome. That's what I'm teaching with the DNA virus. And then again, if you look at the serotype, we are somewhere from A through G. So these are some of the serotypes that we have. the common diseases caused by these adenoviruses, again, as I said, is going to go for upper respiratory tract infection, pharyngoconjunctivitis, pink eye, hemorrhagic cystitis. What is cystitis? Sorry? Louder. I thought you guys are doing medical terminology, right? Or you already did it, Dr. Saba. Cystitis.
Inflammation of the cyst.
Of the cyst. Very interesting. Bladder, urinary bladder. You're too smart than me. Okay. Gastroenteritis. Again, he's right, because anything that ends with itis is in front of, there's no such thing in the body as cyst, right? It could be anything. But when we say cystitis, we basically mean a urinary bladder. Okay. The general characteristics of adenoviruses, and again, yesterday I showed you the picture. It had the type of RNA, type of DNA, the genome. And one of the things I emphasized at the time, that it can come in SS, DS, single segmental. So that is important, because once we have antiviral therapy, we're going to talk about that. This is a linear double-stranded DNA, and it's non-enveloped. The moment I say non-enveloped, you should always flash back and take in mind it's not destroyed in the environment, remains stable, easily transmitted, because it's a naked virion, because it doesn't have the bilipid layer outside. Virus enters host by receptor-mediated endocytosis that we already discussed the other day. So there are corresponding receptors and corresponding things that are there. Just I thought of my, because Ransford just joined as a capstone student, and we are learning how to take data. So one of the things that I will mention is called false positives. Now, for example, if I was to take this data for a attendance sheet, where is the attendance sheet? So people will sign the attendance sheet, right? And I want you to assume that those people who are here, they are here to listen to me, right? Then I find out that people are taking notes and people are doing whatever they are doing. But one of the things which could be false positive is the person can walk in, sign it, go out, and never come back, for example. So according to my data, it will say such and such person in the class. I can see it because I know all these front people by name. So then I noticed that would be a false positive. It's wrong information then. So we have to, we have to exclude that. We have to exclude that. So these are some of the data points that are there which cause problems, okay? So these are some of the unique features of adenoviruses. And you can see from here, they have double-stranded genome. They come with DNA polymerase, okay? And then again, if you look at the infection, and these are some of the slides, what I would do is that, because I'm teaching you separately, I am not sure if the new book has made a detailed table so you can compare and contrast. It may look easy to you. I'm just teaching you human papillomavirus and adenovirus. Good. But the questions are going to be jumbled up when it comes for, so you have to compare DNA with RNA. So you have to have, most importantly, for example, say tissue tropism. If I ask you tissue tropism of adenoviruses, I'm talking about respiratory tract. And then again, the other important thing is that they cause lytic, persistent, and latent infection. I'm pretty sure some of you may have signed up with our faculty to do research. And one of the research we do research on cell lines. So these cells lines are called immortalized. They will never die. You know how do they make them? They take those cells and infect them with HPV or a virus, so they would never die. So keep that in mind, that if you get a cancer with HPV, it's going to proliferating, never die. So the problem over here in terms of growth. That's why we say immortalize certain animal cells. So this means once you get viruses, you get this disease which was never going to end. That's why we make the cell lines. The cell lines over there in the lab, they're frozen, taken from there, thawed, and they grow over and over again with no death. So that is a problem for the cancers caused by, that's why cervical cancer and oropharyngeal cancer, all these cancers are big issues. Now, I talked about lytic cancer, lytic, latent, and transforming. So these are three different pathophysiology, and these are some of the abilities of these viruses, okay? And then again, once they line the epithelial cell oropharynx, right? They can also go to respiratory tract and also go because of the route. The route is like pharynx, it's going to go either into windpipe, it's going to go food pipe, and then we have all these important things. The most important thing in this wall is that they have a toxic activity in the protein, which is there, that will basically help them to cause tissue damage. So by the end of the day, we get disease because the tissue is damaged. And the tissue gets damaged, they are unable to perform the function. Right? So we have organ failure. That exactly is the case in terms of pathogenesis of these particular cells. The other important thing, if you look at the hallmark of adenovirus infection, if you want to take a tissue, like for example, and see what's happening over there. So what you will see is that the cells, because of these viruses, if you compare that, for example, we call these special body called inclusion body. That's another term that we want to use. Inclusion body. So they're very specific structures which are called inclusion bodies. They are present as a hallmark of cell death. So the moment you look at a cell, like cell scraping, I gave you an example for the pap smear, they look at the inclusion bodies. This means viral infection. This means viral infection in terms of infection. But you can, if you compare with, for example, cytomegalovirus, which will cause cellular enlargement. So we call it cytomegalovirus, because cytomegalovirus is something that may cause cancer. Who did the project on cytomegalovirus? Every time I ask something, amazing. And then again, in terms of the spread, and it's pretty much, if you know the basis, you can extrapolate that. And then the other important thing is that if you want to have a treatment, antibody is important for prophylaxis and resolution. So antibody does work for adenoviruses because the cells which we target are mucoepithelial cells. Okay. Now, this is another slide as we have the slides over in CDC life cycle. And you will see from here, very common in almost all the sites. It's pretty simple. The thing is, the virus gets into the system, goes into the tissues of liking, goes to the lymphatic system, and from the lymphatic system goes to the blood. We have viremia, and wherever it blood takes. The only difference that you will know in terms of where it's going to lodge and get deposited, that may be the difference in terms of what disease it causes. Okay, pretty much the same. Transmission typically is going to be the same for all the viruses, depending upon whether they're going to go into the respiratory tract, sneeze, simply if you're going to go to gastrointestinal tract, fecal oral route. If it's the contaminated water, again, fecal oral route. So once you know that which type of tissues is going to infect, you pretty much can determine what's going to happen. Okay, who is at risk? People younger age. Modes of control, we have a live vaccine available, but we don't give it to everyone. We usually give for military use. The reason is because we don't want our soldiers to get sick, especially if they go in those areas. The other important thing that I want to talk about is that the incidences, for example, adenovirus may also cause gastroenteritis. You must have heard about stomach flu, which is not the right word, but I use it as well. So stomach flu basically is not a flu, is a stomach viral infection. In this case, adenovirus, 15% of the cases. In last month or last week, there was a very high incidence of stomach flu in the population, especially in Illinois. There are some specific clinical diseases Pharyngoconjunctival fever, it happens in younger people. I already told you the infantile diarrhea, gastroenteritis. There's nothing you can do because you cannot predict, hey, but this kid is going to get diarrhea, so let's give him prophylactic antibiotic. We don't do that because we don't know. But as I said earlier, it is available. The treatment for most of the viral diseases is pretty much reduce the transmission. There's no approved treatment. As I said earlier, live vaccines are available, not for civilian use. They are given to military, to soldiers, and I'll give you why do they give it to soldiers, okay? One last thing, you must have heard of gene replacement therapy. We'll talk, if we do, how we wanna, if you have a deficient diabetic gene which is required for diabetes, for example, we wanna give you that gene. So what happens is that we put that gene in adenovirus and infect you with the adenovirus, and that adenovirus will inject, because it goes into the cell, that gene into your cell. So that's a good use of adenoviruses, that they are considered as a gene delivery virus, right? We call it like a gene gun. So they basically act as a gene gun where we put the appropriate gene into it, right? And then give you infection, and then you basically replace that. Okay. Thank you. And is there any question?